Hi, everyone. I'm just going to wait a couple more minutes for people to start joining in, and then we can go ahead and start.
Great.
All right, we'll go ahead and start. People can keep adding in as they come. Hi, everyone. Welcome to Iowa State's first pre-health conference. In this session, we'll be hearing from physician assistants on their experience with graduate school as well as their work life. First, I would like to start off by introducing our panel. You guys can go ahead and individually introduce yourselves, just some of your background and where you're at right now.
I can go first. My name is Mary Jo Pilot. I'm a physician assistant. I've been a physician assistant for about 20 years. Started out in oncology, graduated from the Wayne State PA program. Started out in oncology and am now currently switched over to education about 6 years ago, and I'm currently the program director for Wayne State PA program.
I'm Jean Starzinski. I'm a 1980 graduate of the Duke program. I started out in cardiovascular surgery, and then after working 100 hours in 7 days, I said nuts to this, and spent 5 years in plastics, and then actually was hired into OBGYN and advanced reproduction, which is really my passion. I did that for about 5 years. Continued with OBGYN, but then moved into urgent care for a while and started a clinic here in Minneapolis with a physician. And we ran that for 10 years. It was primary care, but lots of OB, lots of GYN. And then I went to straight family medicine and ended up out in California for 3 years. And I'm licensed there as well in advanced reproduction. Then one of my OBGYN docs that I worked with called me and said, you should come back to Minnesota and teach at Bethel. And he is our medical director there. And so I did that. And I've been at Bethel almost 6 years. So lots of different things. Maybe I'm a little ADD, I'm not sure. But lots of experience. So.
I'm Ivy Himes. I'm one of the alumni from the University of Wisconsin lacrosse program that's partnered with Gunderson Lutheran, Mayo Clinic in Rochester, and also Marshfield Clinic. I have a mix of family practice experience, urgent care, sports medicine, and then most recently with COVID, I've been in the respiratory clinic now for the last year. I joined on faculty with the University of Wisconsin lacrosse program a year and a half ago, and I'm also admissions director as well.
Hi, I'm Alan Platt, and I'm from Atlanta, Georgia. I did my undergrad in health systems at Georgia Tech, so I graduated in engineering. Then I got accepted into the Emory PA program, graduated in '79. I worked at Grady Hospital, which is our 800-bed inner city hospital, 5 years doing emergency walk-in work, and then got recruited to start a sickle cell center, a 24-hour emergency room for sickle cell patients, staffed by PAs. That was unique. Got involved with that for 20 years and got to do research, informatics. I got to do engineering and PA, kind of cool. Then I went, after 25 years at Grady, I retired Grady. I said, I'm going to be an educator. So they kind of suck you in, and boom, I'm teaching now. I've been teaching for 15 years. I'm also director of admissions at Emory. And so come south, it's warmer here. Well, it's 24 today, but we have no snow and ice here. We freak out at, anyway.
Thank you all for your introductions. We're excited to hear from you all today. So to start us off, I have a couple general questions that I'll be asking, and if any students have any questions, feel free to drop it in the Q&A box and we'll make sure that those get answered. So to start us off, anyone can answer these. What is a typical day for you at work?
Is that pre-educator or post-educator?
Yeah, either or.
Yeah, I think any day at Grady was unique. When you're clinical, it was emergency care, primary care. It was every day had something new. We worked hand in hand with hematologists, but the PAs were the front line. So we took care of all incoming patients, did the history physical, started our own IVs, gave medicines. And then we'd let our attendings know what was going on. We admitted, we did everything. We basically were the arms, eyes, and legs of the physician. Who we had one hematologist, so we had 6 PAs. So we all had his mind, because he had to go home at night and sleep. So we kept it running 24/7. Life as an educator is much more slowed down. It's more scheduling classes, teaching classes, doing labs, working one-on-one with students. So that's a whole new world, but it's with some of the best people on the planet.
And I currently am working part-time at Mayo in urgent care, and then I'm also teaching part-time, which is a really nice mix for me. So on my clinic days, it's a walk-in urgent care. So essentially, I'll give my last example. On Thursday, 2 days ago, some of the patients that I saw, one, we had a diagnosis of a lung cancer where it was an 11 by 7 centimeter mass. So this was just the first patient that I saw that day. To a kid who cut his head on a car door, so we had to put staples in that. And then obviously with COVID, we're seeing also patients with respiratory symptoms. So we're doing COVID testing in urgent care as well now. So you just get to see a variety in urgent care, which is something that I like. And you'll also, my previous practice in family medicine, you would have physicals that you would see throughout the day. We would have chronic disease management for patients with diabetes and hypertension. And then you'd also would have acute visits previously, like the ones I had described. So it's, for me, family medicine and urgent care has been a nice mix. So you have a breadth of knowledge, but not necessarily expertise in one particular area, but you get to see a little bit of everything.
Well, so, I think, again, one of the advantages of being a PA is that you can have a varied work life. You're not doing one specific thing all the time unless that's what you want. So I think I would agree that the life of an educator is not as perhaps dramatic is the word, as, although it can be very dramatic actually, now that I think about it, but in terms of life or death, it's probably not quite as dramatic. I think for me, the whole part of being a PA and being an educator, regardless of what field I practice in, was getting to know and taking care of my patients. One of the reasons I liked women's health and I really liked family medicine is because I developed long-term relationships with people and really had a chance to see if we couldn't impact their healthcare. And you just got to know them. I knew when their anniversaries were. I knew when their grandkids were born. I knew when a couple was trying to get pregnant and when they called me first to tell me the test was positive. All those kinds of things in addition to the medicine. So the medicine is fascinating. The relationships are sustaining, is how I put it. As far as education is concerned, I always tell them I'm their PA mom. Actually, I could probably be their grandmothers. Our class is so young. Our classes are young, but it's a chance to help these really smart, driven young adults get their feet on the ground and develop a profession that they can work on the rest of their lives. So it's a privilege. It's a privilege to teach.
Well, I'll piggyback on everyone. So I started out in oncology because I was a researcher before I started in the PA program, and actually made my way into phase 1 clinical trials in oncology. So my main role was to run phase 1, which is early drugs with little track history and sometimes their first in human studies. So that kind of melded my research background with my clinical background. So I will also mimic what Jean said, which is the best part of being a PA was the relationships I developed. And certainly I was able to be with them at a very stressful and very unique time, which was mostly at the end of their lives, which really is very an honorable situation to be in. That does take a toll on you, and it's not for everyone. But I agree, spending that time with their families, with the patient is really something that I don't think clinicians in the physician world have the time to do, to be honest with you. They're really the ones who are doing all the other stuff, shall we say. Transitioning to education, I still work clinically 1 day a week. So I still have that connection, which I don't think I ever want to give up. And I actually miss the day-to-day with the patients. I wish I were in all of your educations, because I feel like education is not as easy sometimes as being a clinical PA, primarily because of, I mean, I don't know. I know you guys have probably had the same stress that we've had moving on to an online situation and doing that during COVID. That's been certainly a challenge for all of us. And I think moving into the administration world, which was not something I see myself into, but certainly I'm learning every day, has also put an added bulk of work to do. But certainly it really is fun to teach students that and you love to watch the light bulbs pop on. That I think is the best part of the whole process. And just watching someone be so excited at the beginning of their career. I think sometimes as you move along in education and in your job, you sort of forget that joy that you had all the time and that excitement that you had every day when you were becoming a PA. And that is great. It's a great experience to have on a daily basis. So that's it in a nutshell for me.
Thank you guys. It's very interesting to hear about your various experiences and what fields or positions a PA could become. I have another question. What is one thing you wish you knew before applying for physician assistant school or becoming one?
I'll speak for my students as opposed to myself, because I came from a graduate background. I think some of the students that we have that come from an undergrad background to a graduate school background, that transition is a shock to them. I know they hear it and they hear it from us all, but I think that first semester, they have no idea how much is going to be thrown at them. So being prepared, I tell students who are interested in being in the PA program, the best skill that you can learn is time management. It's actually better than science, to be honest with you, because you really need to be able to manage your time, study appropriately, and get all the things that you need to get done in one day done on time.
Does anyone else have anything to add on to that?
I think clinical experience, just get behind the doors, work with doctors, nurses, PAs, nurse practitioners, talk to them, see if they're happy. Because you want to go into this knowing this is going to be your lifelong pursuit. Because PA school's hard. It's no joke. It's drinking from a fire hose. And in the tough times, you really want to be motivated that this is, keep your eye on the prize. So I think being in healthcare, seeing what healthcare is all about, get a job, take a gap year, work in the hospitals, talk to all the different professions. So you get in your heart of hearts, this is what you want to do.
To spin off of that, we do have one question in the QA box. It's about what you just talked about. He said, healthcare in general does not seem like an easy field to work in, and it sounds like you all have worked in it for a long time. So what have you found that keeps you motivated?
Well, the motivation comes from taking care of patients for me. Is it exciting to put all the pieces of the puzzle together and figure out what's wrong with somebody? Yes. Is it more exciting to treat that patient and see them actually get well? Yes. And feel like you have made a difference. Sometimes it's not as dramatic as that. Sometimes it's holding someone's hand with their daughter sitting there and explaining what dementia really looks like. You know, so sometimes it's painful too. But I think we can be a blessing to others. And the more you do, the more you can do. So I often tell my students as a PA, I have been at times really tired, just worn physically out, especially when I've been up all night in the OR. But I have never, ever been bored. And if you're bored at what you're doing, find something else in the profession to do, because there's no reason to be bored. Wouldn't you all agree? No reason to be bored.
I have a 3 bad day rule. If you're having 3 bad days, it's time to move. So, and PAs are migratory. We can change our direction, just changing our paperwork. Don't have to go back and reschool, reboard. You just need somebody to hire you and say, I'll train you.
Or you can move and work internationally and learn a whole new healthcare system. And work in areas where you have to be really, really, really creative because they don't have all the bells and whistles that we have here. So lots of things you can't do. Picking it is probably the most difficult.
It's nice to have that flexibility though. So I have another question. How long did it take you to feel comfortable to treat patients after graduate school?
I think good jobs train you and start you slow. You want to be mentored your first job because really PA school is just a foundation. Now you're an apprentice and you need a good group of mentors to take you under their wing and let you start seeing patients day one, but start slow. And you always have backup and then let you start to gain more and more. It takes, I would say, a good year to get solid in your profession. Whichever specialty, whatever group you choose, to really fly and be solo and to have independence. It takes a good year, I'd say, for most of people coming out of PA programs.
I would agree, about a year. I'm thinking back when I first started, I had a mentor for 2 days and then he ended up actually moving out of the country. And then I kind of got stuck by myself. So I would say about a year. And this is for from a lot of you, and I don't know if you're having the same problem in your other states, but in Michigan, a lot of our grads have taken jobs in urgent care as their first job. And I would caution all of you who are planning on doing that as a graduate, because a lot of times at least the urgent cares in Michigan, they give you the idea that you're going to be trained, but the reality is you're there for a couple weeks and you have training, and then it's you and an MA running that clinic. And as a new grad, that is very dangerous in my opinion. So I would caution you on those who are taking their first job in that situation.
But also, I hear this a lot because I am deeply involved with admissions. I work with our admission counselor. I hear this a lot from our interviewers that they want to be PAs because you can move from one specialty to another, which I have done that, as was clear. And my point here is that you don't just hop from cardiovascular surgery into OBGYN and think you're going to know what you're going to do, because you don't. It takes another year plus of training in those specialties. It's a steep learning curve. It's studying at night. It's looking things up. It's driving your precepting doc crazy with questions. It's all of those things when you switch specialties. So can you do it? Yes. Is it easy? No.
And to piggyback off what my colleagues have said, I do agree that it takes typically a year to get comfortable. And I'll tell my students that one of the most important things to consider in a position is, as opposed to the specialty, the call, the pay, it is your support system and who your supervising physician is going to be, because you will learn more your first year of practice than you will your 2 years in school. I still remember the first patient I saw solo, and what I diagnosed him with and where he was sitting in the room. So it's that first patient you won't forget. And at that point, you want to make sure you have a really solid onboarding process. That's going to be the most important thing your first year of practice.
Thank you guys for your response. That's nice to hear that there's people there to transition you into it, so it's not just going on in there. We do have a couple more questions in the Q&A. Does anyone have experience working abroad as a physician assistant, and is the profession/degree recognized outside of the US?
So I haven't worked abroad in terms of being someplace for a long time, but I've done several trips abroad. You have to be really careful, because I sort of found this out the hard way. Just because a country has clinical officers does not mean that they recognize physician assistants. So we had connections through Bethel with Samaritan's Purse Hospital in a place called Chogoria, Kenya. And it's a rotation for our students, actually. So I hopped on a plane and went over there. And when I got there, discovered that I wasn't licensed. I couldn't get a license. The hospital where I worked wasn't going to give, even though we had students there, they weren't going to give me access to their computers. And my Swahili, it just wasn't. So I ended up working closely with a clinical officer, which was a great experience. I had a great time, actually. And we saw 50 patients a day, but they also don't do a lot of physical diagnosis. So I was ending up doing all the physical exams because they just don't do them. So it was a learning experience for me. I have not gotten back simply because I don't feel like I have the support there as a PA. I've also been in Nicaragua. And if you want to go internationally for a short time, it's good to go with a group. Like, there are all kinds of groups that take medical people, and they will credential you here in the US and accept your license or whatever state you happen to be from. And they will take you to wherever you're going and provide you with the resources you need to work there. And you really do get to work there. However, you really need to explore whether giving somebody 30 pills for their high blood pressure is going to be helpful for that person in 6 weeks when they don't have any more medicine for their high blood pressure. And what are you going to do about that? So I think there are countries where you can practice. You can practice in the UK. You can practice now in Ireland. You can practice in Australia. New Zealand, maybe. I don't know. But some of the underserved in Africa, you can practice in Liberia, and one other country, I can't think of the name of it, where they actually have PA programs instead of clinical officer programs. So just be careful when you start thinking about that you end up someplace that accepts physician assistants, because a clinical officer and a PA are not the same thing.
I'd agree. We have a dual degree MPH PA program here at Emory, and several of our MPH PAs are working for the CDC, and they're going abroad as members of CDC teams. So I think an MPH degree opens doors global because they understand what an MPH is. A lot of countries don't know what a PA can do. Our JAPA journal just came out with all the countries that get it. I've got the screen if you want to see it, but it shows you all the countries that do have PA programs. I'll share it with you if you want. No, I don't have sharing.
Oh, okay.
I believe I just changed it. You should be able to share it.
Okay, it shows you all the countries that do. Let's see, here you go. Can you see?
I can see, okay. So Ghana, Guyana.
There's a big screen.
Yeah.
So these are all ones that have programs, but again, they may not, what your duties may be are, tailored by the laws of the land. And I would be a US trained PA and then go abroad, but I'd go go with a US group or CDC. And like I said, CDC will not hire you unless you do have an MPH. They really want you to have that public health background. And I have a colleague now that's over doing HIV in Africa with the CDC. So our graduates all over the globe, but they're working for US based organizations.
Good point.
I'll stop sharing now. But this is right out of our JAPA journal, just came out. Hot news.
Thank you for that. That was very interesting to see what countries do recognize PAs and to learn more about MPH. I did not know that was a thing. We have another.
George Washington University has a public health degree as well, I think.
It's an extra year, but you get year credit for being a PA and going to public health, and you get done in 3.
All right, good to know. We have another question here. Did any of you have clinical fears before entering your PA program? Example, surgical procedures, putting in IVs, and is it okay to enter a career in healthcare with those fears?
You should have fears. Healthy fears. It's a respect, but they're going to teach you all that, and you're going to learn all that on clinical rotations. You're going to have people show you. We give you labs with plastic arms and things like that, but really you have to stick a real patient your first time to learn these things. So we give you the basics, but then it's on the job training on your clinical rotations and then on your job. That's where you really, really learn.
I think some of the fears that people have can be relieved with good pre-PA training, healthcare experience. I think I worked in a small community hospital, and they'd let you do just about anything if you were willing. Some things probably I shouldn't have been doing, but they will let you do it. And like I said, you need to see that people are messy, that people die, and that's what the whole experience part is, to expose you to that messiness. and get you, to see, do I really like this, or do I really not like this? Do I want to do more? Is this exciting or not? Is it terrifying? I don't want any part of it. Before you get into PA school, I think that that's a big part of what that experience brings to the table.
I agree. I think the pre-PA program experience that you have will only help you through the program, as well as also being a PA. However, I think it's right that you should have a healthy fear. I mean, you are taking care of patients, so I think some of the worst PAs that I've worked with are the ones that are a little too cocky. Clinicians in general, let's just say that, not even just PAs. So knowing that you have to have that respect for whatever you're doing for that patient, and know that you have the confidence to do it, but also know that you have to do it very carefully and not be too abrupt about it.
It's definitely good to know to have that balance between a healthy fear and being prepared. What would you say is the biggest issue facing healthcare/medical practice today, and how can aspiring medical professionals best prepare to address this?
My vote is healthcare accessibility and cost. And really, we have several vulnerable populations who have no access, and it's still a problem. Our program goes down and takes care of migrant farm workers who pick our crops in South Georgia for 2 weeks. And some of these people have never seen a physician PA in their life, and they have no way to get to them. So we go farm side and actually do a mini medical mission down to South Georgia and take care of them, and just free care, free clothes, free food, free healthcare. But that's right in our backyard. I think in downtown Atlanta and cities you live, there's underserved populations. I worked at Grady, which basically if you could make it in the door, Grady would take care of you. It's a safety net hospital, but so many, my sickle cell patients were, had no care except ERs. And it was tragic to hear the stories. And I think PAs can make a difference as being open to serve these populations that really have no access. I think we're the answer. So be a PA.
I have been fortunate in Minneapolis to work casual part-time at a federally qualified health center. And I have seen more international patients and more tropical disease there than I ever saw on my trips to other countries. The first time I actually saw a patient who was starving was 10 minutes from Bethel University, which I can tell you is not an underserved population. And he was an immigrant. He was working, he was hardly making anything. And he had no idea what kind of resources were available to him in terms of kitty corner to the apartment where he and several people were living. Was a church that served dinner 365 days a week, but he didn't know it. So, I think a lot of our big cities, Atlanta, Minneapolis, New York, all these whatever big cities, Los Angeles, there are underserved populations from all over the world that you can help if you want to. It's there.
I would say a separate issue that is continuing to be prominent as we expand in medicine is dictation from insurance companies with regards to how we care for patients. So that can go from essentially cost of prescription medications to reimbursement with regards to some of our patients. You get reimbursed on the complexity of the patient and how well you're taking care of those complex issues with that patient. So many times we're dictated on how we practice as opposed to we just want to take care of the patient. So that's something that you will encounter. And unfortunately, it seems to be something that is only growing with regards to how integral insurance companies are becoming in part of your practice. So that's something we'll have to look forward to. but it is manageable, but it's just something that will affect your practice.
Yeah, I think actually both points are very well taken. The insurance issue is becoming a big issue where I work. Our corporation, for some reason, doesn't understand how to bill for PAs, even though they're a massive corporation. And it's very interesting the amount of work that they don't do to do that, and essentially throw our billing out the door. The other thing that I would just think about in my head that came up is competition from other people who practice like us. We are directly in competition with the nurse practitioner world for our positions. And depending on where you work in the country and what field you work in, for example, in oncology, it is a very NP driven world. So you are in competition with a very large group of people for resources, um, for leadership positions in your hospital. Many of our nursing groups are unionized, where PAs don't tend to be unionized, at least in Michigan. So you're constantly struggling with that as a PA working in that environment. The surgical procedures tend to be a little bit more PA driven, so there's a little bit more clout in that area. But I would think, yes, access to care is huge in the city of Detroit. We do street medicine. One of the things that we're very actively involved in our program is we work with our Special Olympians, because in the inner city, the Special Olympics, the children with special that are underserved in Detroit, they don't have access to just basic physicals to do the Special Olympics activities that they can do. And I mean, just simply doing a simple sports physical has now allowed these kids to get into sports programs that they weren't able to do because their parents just don't have the time to do that. They're working. So I think all of these things are important, along with the fact that we have competitors out there, and we have to prove ourselves, and get bigger in numbers. And so be a PA, that's what we're saying.
Thank you for that. That was interesting to hear about the competition and then just being an advocate for public health access. What is your personal favorite and least favorite thing about being in your profession?
So I think we could all agree that I think taking care of the patients and getting that feedback from the patient, or just even knowing that you've helped them, I think we all went in the field to help patients. Um, every job has a downside, right? So you're dealing with administration sometimes, you're dealing with huge patient loads that can be a little rough. You're dealing with people not understanding what your role is. I mean, there's all these different things that can happen, but that's in any job. When I interview new people for positions, I actually tell them the worst part of the job, because I figure if they understand that, the easy part is the good part of the job. So you don't certainly want to color code the job that you're interviewing someone for, because you may not actually end up keeping them. So I think those are the things that I would say.
And my favorite part of the job, as Mary had alluded to, as well as taking care of the patients, that is what gives you the motivation and the spark to keep doing what you do every single day. And each day being different from the standpoint, each patient is different. My least favorite part of the job is dictation and notes. However, those are obviously the most integral part of seeing a patient, because that is what signifies continuity of care. So it's an important part. So that's why, because of its importancy, making sure that that is something that's completed and thorough is absolutely of the utmost importance. But it's a part of my job, unfortunately, that has a clinical burden with it.
It's critical. It's really critical. That's what keeps you from getting sued, actually, are those notes. So that's a possibility on occasion, whether you've made a mistake or not. It doesn't matter. You can still get sued. So your notes will keep you safe, actually. The part I as I've said, and Mary and Ivy and Ellen, I think we all agree that we do what we do because of the people that we take care of, or the students that we teach. That's what we do. The business part of medicine drives me crazy. You know, like, did I click every box? Did I remember to add a code so that I can bill for 2 diagnoses and not 1, and on and on. And so, but unfortunately, you know, I like to get a paycheck. And so if you don't bill the way you're supposed to, that gets threatened. So every job has its negatives, but really the look on people's faces when they get better is worth all of that nonsense that you have to do.
I totally agree. I like when I've worked with some fabulous providers that have mentored me, and I've been able to be flexible. I've been able to have a life outside of medicine and raise my family and do their basketball games and go that. My physician didn't, and he, you know, he had regrets because his family never saw him because he was so busy at the hospital. I would go home. I say, you know, I got to go. I could work shifts, and it kept me, basically I could do other things besides medicine. And I think a lot of people pick PA because they do want a life outside of medicine, because medicine can consume you. I really appreciate the ability to have family time, vacation time, and all those other things. I think you need a good work-life balance, and I think PA affords that. You know, you can get consumed as a PA also. You could work 80 hours a week, but there's jobs that don't do that. So I'd recommend don't go crazy. Keep your life sane.
Going off of that, we do have a question similar to what you just said. Is that the reason that made you become a PA over a doctor or a nurse practitioner, other medical professions?
No, it's the only thing. I was not pre-med anything. I was an engineer, so the only thing I could get into was PA school. and luckily my interview was one PA, and he said, "Oh, you're an engineer. We haven't had one of those. You're it." I could not get in with this people today. I would not be eligible. So it was open, it was new. I didn't know if I was going to take off, but it turned out to be something fabulous that did take off. I didn't even know if I would have a job waiting for me when I graduated, but fortunately somebody at Grady said, "Oh, come on and join us." I'm so thankful because this thing did take off, and now PAs are respected. PAs are have a great place in the workplace, and we're being paid adequately, I think, and it'll continue as long as we bring up a new generation. So
I think it's important, and when I'm talking to pre-PA students, is that you don't go to PA school when you really want to be a doctor, because you think that if you go to PA school, it's like being a doctor. Okay, we do lots and lots and lots of things that doctors do, but there are lots of things that doctors do that we don't do. So I always tell people, if you want to hold the knife, you know, now I've done lots of surgery and I've held a knife, but what I'm talking about is when you crack a chest, you know, can you as a PA crack a chest? Sure you can, but the doc is right there to finish the case, okay? So if you want to be the surgeon in control of the knife, for the most part, PAs don't do a lot of deliveries. Some places they do some. Minnesota, I don't think there's a PA in Minnesota that does deliveries. There are PAs here that work in OB, but they're not actually doing the deliveries. You have to do a lot of deliveries to be safe. One of my students just completed the OBGYN residency program at Riverside in California, and she did over 200 deliveries in that year. And she's working in an OBGYN clinic. She's not doing deliveries. So if you really want to catch babies, then you should think about being a midwife, or you should think about going to being a doctor. I think I think that you become a PA because of the values that PAs have. You become a PA because you like what we do and how we interact. And frankly, I became a PA because the PAs I knew, I liked them as people much better than, unfortunately, the doctors that I knew. And I thought, I want to work with these people. These people are great. And I have, over 40 years, I have not changed my mind about the PAs. I know they are really wonderful people. But I would strongly encourage that you don't decide to be a PA because you don't want to go to school for 4 more years or whatever it is. You be a PA because you want to be a PA.
Yeah, I would totally agree with both Alan and Jean. You know, if you want to be top dog, there are positions that you can be top dog, but the majority of us are not. And frankly, I have always lived my life being that person that is behind the scenes that does the work, but doesn't necessarily get the glory. And I'm totally fine with that. If you are a glory hound, a PA profession is going to be hard for you because ultimately you might have done all the work and your doc that you work with is going to get the glory for it. And I'm totally fine with that because I know that I did it. And I would agree with Jean, if you want to be a physician and think that the PA world is the easier way out because of the 2 years, it's not, it really isn't. You know, and I would assume that the majority of you are pretty young in this audience and you have the time to do that, that this is what you're going to be doing for the rest of your life. You don't want to look back when you're in your mid 40s and think, wow, I should have went to med school. You have to sort of make that decision at the very beginning. Otherwise, it's going to be something that you're going to regret. And this is too hard of a program. Most of the time, our students, I think in all of our schools, we can say that we have just as the grades and the competition to get into a PA program are sometimes even higher than getting into a medical program. So if you've got the grades to get into the PA program, you've got the grades to get into a medical school. If that's where you want to go, then that's where you should go.
Amen.
Very well said. Thank you all for your input on that. It looks like our session time is about to be up. I appreciate you all for coming. Thank you specifically to the physician assistants for offering up your time and helpful advice today. We loved hearing from you. Students, for the next session, feel free to go onto the Iowa State Pre-Health website. I'm going to paste it in the chat so it's easier to find, and then you can go on to your next session. Thank you all today. Have a good day.